For most nonprofits, annual meetings are a legal and financial necessity, but for many of us in attendance, those meetings and fundraisers are also time-consuming with high levels of ceremonial tedium. But the advocates at Healthcare for All have been working on a cure that's heavy on conversation. To tell us what they have in mind is the group's executive director, Amy Whitcomb Slemmer. Thank you very much for being with us, Amy.
My pleasure. Good to see you.
First of all, you're planning essentially here a conversation, and it seems like this is going to be a timely conversation. So explain what you have in mind.
I think that's exactly right. So every year, Healthcare for All throws an annual fundraising event called For the People. This year, we decided instead of having us talk to the people who are assembled and our sponsors for 2 hours about the marvelous things we've done in the last year, we would really spend time engaging the individuals who've shown up to talk about a particular topic. And this year, we want to talk about patient-centered care, and we're flipping it on its head. We want to talk about patient-centered care from the patient's perspective. So we have guided conversations in 3 parts of the room going on simultaneously. We know that that's going to create a buzz and some excitement in the room, but we'll be talking about patient-centered care at end of life, which will be led by Andrew Dreyfus. We have Rashika Fernandopoulos talking about patient-centered care in team-based settings and shared decision-making. Lynn Quincy, who's come out from DC, from Consumers Union, is going to be talking about, I have insurance, but what about the cost of that care? And then we're going to talk about valuing our religious and cultural beliefs with Reverend Jenny Gould, who's from BMC. We're very excited to have them begin to provoke conversation within these smaller group settings.
Explain the concept of patient-centered care.
Well, I think there's a wide variety of definition about what patient-centered care really means. And what Healthcare for All wants to do is talk about it from the patient's perspective. How do we experience team-based integrated care? What does it feel like to have our values focused on at the end of life, at a critical moment in care that we're all going to experience? And what we're going to do is build on the information that we get in the room and really create a patient-centered care policy agenda going forward.
Well, of course, the other thing that's going on, and we're getting this from the governor's administration, that he wants to reorganize the state's participation in Medicaid to have care that's more cost effective and maybe better coordinated too.
That's right. So one of the things that has to be addressed is the state budget and the amount of money spent on the Mass Health program. Healthcare for All advocates for vulnerable people across the Commonwealth, and we care very much about the quality of care that Mass Health members receive. So when you talk about better coordinated care, one of the things you have to do is change the way you pay for it. So Mass Health is going to drive a reorganization of the program based on these global payments. And again, you want to hear from patients and consumers about what is valuable within a global payment. What do they need to stay as healthy as possible? It's a transformative moment, and we're very excited to be able to bring hundreds of people together on Tuesday.
It's also interesting here because this is a different idea of advocacy. I usually think of advocacy sometimes almost being adversarial, that people with less power go after people with more power, but you've got these different people who are, all these different kinds of stakeholders in one place.
You're exactly right. And, we're incredibly fortunate to have our funders and our sponsors who are going to stick with us in this experimental moment. So they care very much about the healthcare system. They appreciate that having a strong consumer presence and being able to understand what consumer priorities are will make a difference to the work that they're doing every day.
Talk about the future of patient-centered care when the cost pressures are limiting choice. We've seen some signs of this already. Certain plans won't let you go to certain providers who maybe are a bit more expensive than they should be, but I have a feeling this is not going to be about 1 or 2 providers. It's going to be more and more probably.
The cost issue is a real conundrum, and the way it's experienced for individuals is that their out-of-pocket costs are keeping them from getting the care that they need. Better understanding what needs to be in a robust network so that people have access to the specialists that they need to see, so that the care is coordinated and providers are talking to one another. I don't know if you've had this experience, but we hear from people every day that they are their own traveling health record. They have to be answering the same health questions every time they see a provider, whereas in team-based care, we know that there's some savings to be had and more time to be spent with your provider if they've already talked to one another and know about what your values and what your healthcare needs are.
Well, talk about some of the other things that Healthcare for All does for people. I know you talk about essentially trying to shape policy, looking out for funding, but another thing is you're helping people negotiate all the red tape. I mean, there are people who, I'm sure you're getting calls from people who say, I paid the bill, and they tell me I didn't pay it, and I mean, you still have to do some of that.
We absolutely do. So one of the things that Healthcare for All prides itself on is being able to figure out, get in the problem with the person who calls us. Our helpline is this phenomenal service that allows anybody in Massachusetts to call and get free help navigating whatever the glitch in the healthcare system is. We're happy to talk to people in English, Spanish, and Portuguese, and we better understand what the problems in the healthcare system are when people call us. One of the groups that we're currently helping are the Verizon striking workers who are having trouble paying their premiums and maintaining their health insurance while they're on the picket lines. Healthcare for All has been able to provide them some help and figuring out some navigation assistance so that they can get the care that they still need.
And that number that people should call is?
Thank you for asking. It's 800-272-4232. And we're happy to take calls, and it helps Healthcare for All as we're helping individual consumers.
And finally, I got to ask you about the time and place of the event and how people can get more details about that as well.
Thank you. The place to be on Tuesday from 5:30 to 8:30 is at 60 State Street. We're actually going to be in the stateroom on the 33rd floor. If people come, we know they'll have a really wonderful time with us, and we appreciate that they're investing their time and their money in helping us move forward in creating a patient-centered agenda for Healthcare for All.
Thank you very much for being with us.
My pleasure. Thank you, Chris. Hope I see you Tuesday.
Yeah, from Healthcare for All, Amy Whitcomb Slemmer.